And we are live, guys. Welcome back to the Conquerors crew. And I'm telling you, I already know this is going to be one of my top three interviewees, guest of the year. I just know this guy, I don't know. We've got so much in common. I am pumped. Dr. Eugene Manley. Sir, if you just can spare 1 minute and let me just tell people, remind them what the Conquerors crew is about. By the way, hey, I got my cancer stuff on today. Had the cancer ops meeting with the cancer challenge, and we have some cancer stuff. And the blue and the blue and the blue. Hey, it's just supposed to be. So, guys, hey, the Conquerors crew, we are about helping people overcome adversity or an issue or anything in their life. We don't care what it is. It can be a life hack. It can be a major thing, but it's always about what was the issue? How did you overcome it? And you share some tools and tips with our listeners because we are about raising the level of the crew. What is that? A rising tide raise all ships or something like that, right? So, yeah. It's like that. Do you know what it actually is? Do you know the actual one? You know what I'm saying?
I know what you're saying. I just can't remember the exact.
Yeah, okay. I butchered it, and it doesn't matter because we all know what it is. So, guys, we're about 3 principles, right? And that is hope. And for us, hope stands for helping other people excel. And it's this funny little thing, right? That there's a few of these kind of things in the universe. And if you're looking for some hope, and you muster just a little bit up and you give it to somebody else and you do a kind act for someone, it comes back to you faster. And I don't try to understand the rule. I don't try to, it just works like that. Right. And so I'm good with knowing if I give, then it comes back better. And it just seems like it comes back a little faster. Right. So whatever you're searching for or looking for, if you give a little bit of that, you'll get it coming back to you faster, right? And the other one is, and grit, grit, don't quit. That's kind of our thing. And for us, grit is grace, resilience, integrity, and teachable. And for grace, it's so easy to give grace to other people, right? Give them a second chance. But it's the reminder of give yourself some grace. Don't be so hard on yourself. Resiliency, that stands for itself. Integrity, that kind of is along the lines of grace, right? You have integrity with others, but when it's 3 o'clock in the morning and you're looking at yourself in the mirror, are you being honest? Are you really? And then T with teachable. If we stop learning, yeah, and if you think you know everything, you knocked off that high horse real fast, right? And the other one is courage, and we have courage, and we like the kind of courage that's just over kind of in the corner of the room that doesn't have to be cocky and arrogant and display itself. It's that quiet confidence. It's like I'm more worried about the guy that didn't say anything than the loudmouth guy in the room, right? And so that's kind of the kind of courage that we like. So this is a safe place. It is about kindness and respect, and we aren't trying to change anybody's mind, and we respect your political opinions and religious or any of that, because we have a commonality, and that is we want you to have a better day and give you the tools to do that. So how are you, sir? Tell me about it. How's your week? How's your day going?
I'm actually doing pretty good. We're over here in New York. We've been in a little cold spell. And today is a little bit warmer than it has been, but we're still below freezing. But I take this with a grain of salt because I'm originally from Michigan, so I should not complain.
Right. You're from D-Town, right? From Detroit.
Yes.
Tell me a little bit about that. You growing up in Detroit and some of that, if you don't mind. Let's just get into it.
So, I guess a high level, I'm Dr. Eugene Manley Jr. I'm a mechanical engineer, biomedical engineer, and a molecular and cell biologist that has done a lot of work in musculoskeletal biology, biomechanics, and cancer biology. Wow. And then I transitioned from hardcore bench research to doing more patient advocacy, patient education, health literacy. And part of this was inspired by some of the stuff I observed growing up in Detroit. I was the youngest of my siblings. First one to go to college, first one to go to grad school, first one to do postdoc. So I had to basically navigate spaces from a deficit, not of knowledge per se, but a deficit of understanding how to navigate these spaces. So I always was the one just doing my own thing, and I never fit in a box because I just never have. And so that's just sort of the approach I take. And I love how you mentioned that, you go for the person that's in the corner isolated. That's sort of how I've always been. If you're the isolated person, how can we help you? How do we make you feel seen? How do you make sure you're not excluded?
Is that how it was a lot and how you felt and that kind of thing?
Let's see. As I further progressed in my undergrad, the classes got less and less diverse. And then when I did my PhD, basically I was often maybe the only one or maybe two. And then as you keep progressing, it still gets even emptier. So you're just trying to navigate spaces, do the best you can, do what you can to make an impact. But depending on where you are, that organizations and systems have frameworks in which they operate. So you don't really always get to deviate from that. So sometimes that makes you, and sometimes it drives you to decide you need to create and do your own things.
Oh, you're leading into it already.
So,
man, hey, well, before we go into that a little bit, what were you like as a kid? What were you into? Tell me about, Detroit. Did you play sports or, yeah.
Ironically, I did not play sports.
Okay.
To be honest, I was a kid with chronic asthma and allergies.
Oh, okay. Yeah.
My father was a chronic smoker, and I knew where he was, but he wasn't in the house after I was 3. But I think the early exposure just made me be a chronic asthmatic. And I would be in the hospital probably 20 to 30 times a year with my asthma until I was about 10. It would just trigger like crazy. I had major seasonal allergies like grass, grass today would still trigger my wheezing. I have anaphylactic allergies to, odor of fish, seafood, shellfish, ingestion of tree nuts. And I only learned my fish allergy apparently by mistake. And I think one day my mother brought something back from the grocery store and it was some kind of fish. And I went to carry it in the house and I started reacting. And so didn't even know. But that is sort of what we learned. So it is ironically a miracle that I survived, because I survived like pecan swirls when I shouldn't have been eating them. I couldn't even eat them. I couldn't figure out why I would get sick. And I'm like, because we weren't really using a ton of EpiPens back then yet.
Right. So, yeah. I mean, they didn't even have
it. Right? Yep. Yeah. So that was early 80s and mid 80s. So yeah, it was let's just say it's an interesting time, and it is a miracle that I survived.
Gosh, man. So dumb question. I'm from the South, right? Deep South. We like to do the 20 question. Who are you from? Where you? That's our thing, right? And I mean, so like in Detroit, right? Did you live in the city or in town? I mean, they have allergies up there, like.
Yes.
Is it like the dust? Is it like the dust from the trees and all that?
Well, Detroit, in the 80s was a rough place, and it's still, a lot of disinvestment, a lot of, the exposure from freeways and all the chemicals and stuff. Sure. And I spent my summers in southern West Virginia as a kid until I was probably about 10 as well. Okay. And so you just learn that sometimes, my grandparents lived in the they were the only people in their part of Beckley, but it was a white part of Beckley. And so if I would try to go play with the neighborhood kids, and they would never want to play with me. And I was just like, really? And I was just a social person. So if I wanted to play with any kids, I would have to do like that 25, 30-minute walk over to the black part of Beckley to my aunt's house, because then there were more kids I could play with. And so, but the interesting thing is my mom didn't have cable in Detroit. We didn't have cable growing up, but my grandparents did. So if I didn't want to go over to my aunt's house, I would spend my summers watching MTV. after me going back to Detroit, singing all these rock songs, and they're like,
"Oh man, that is so cool, man. That's fun, dude. That's fun. That's awesome."
Poison.
Yeah, I go stay with my grandparents. When I was a kid, my mom would let me. I mean, I love my family. Man, I love my family. So my grandparents, I get to go like for a week or 2 weeks in the summer and have my time with my grandparents, and then my brother would. But they had HBO and Cinemax. So we got free movies, man. I mean, I'll just glued. I watch movies till 3 or 4 in the morning, and they're asleep in the bed. I'm just on the edge of the bed. Because we didn't have that. We didn't have that at my house, right? It was Disney Channel. So
True. But
awesome,
what was interesting about growing up is also because there's a couple of things. Because I was in the hospital a lot, I got used to needles and injections, and so that sort of gave me an interest in medicine. And then as a kid, also I love Transformers. Like I think just looking at how things moved and operated, and I think that was around 84, 85. So then I sort of kept this thread of engineering and biology in the back of my head. I did not know it would eventually become a career, but it's in essence what happened.
To me, it's building the thing of the biology and the biology, medical, and engineering, and that's how it starts to kind of fit together. Because I wanted to ask you about that. I was like, when did you know that you liked science and were into science? I feel like I'm talking like the smarter Neil deGrasse today.
I don't know about that.
I'm not gonna do that.
I don't know about that.
I knew you were gonna be so humble about that. But God, I was like, I better prepare, man. This guy's gonna be smarter than that guy,
man. I won't be talking about stars or quarks or quasars, so I think
okay. Right, he's a little more down to earth stuff. It's all good. It's all good. Well, yeah. So, were you smart growing up? I mean, did you have good grades, and were you into school, or was it when you were younger, like, you know what, I think I want to be a doctor because I want to solve some of these problems I have?
According to my mother, I was apparently very shy until I was about 4 or 5. And then she said they sent me to Head Start. And then I found out I was smart. Then they said they could never shut me up. So so then I started getting really good at math and reading, and I always read books. I was a bookworm and a nerd, and I got teased mercilessly because I was just a nerd. And I was like, nope, I love my reading, but I also do my education was my way to get out of where I grew up in Detroit, because very few people got out of that neighborhood because there's just not much you can do there. And there's not much inspiration to leave, but I knew my education was my key to escape. So I focused on that. And that's what I really, really, really put all my effort into.
Awesome. Where did you go to college and your schooling and stuff? I'm interested about that.
Oh, that's an interesting story. So I did my undergrad at Michigan Technological University, which is way up on Lake Superior. Okay. It's about roughly 10 hours away from Detroit because you can't really drive fast in the UP in winter because those lots of lake effect snow. During my undergrad, I took 1 year and went to England. And then another year, I said, I'm not ready to go back to the Upper Peninsula. So I did another exchange program down in Miami. And then I said, okay, I guess I have to go back. So then I had to do an appeal for the school because you're supposed to spend your last, I think, 60 credits or whatever on campus. Can I just get this exception so I can just do this? And so I did that. But also I spent a lot of my summers doing biomedical research. So I went to different research places, even though my undergrad was in mechanical. I did all these different biomedical research experiences. And then I did my master's at the University of Wisconsin in biomedical engineering and looked at knee ligament biomechanics. And then I did my PhD at Boston University. And I high level did a lot of stuff in combination drug therapies, looking at changes in the tumor microenvironment. And tangentially, I looked at the differences in drug metabolism in male versus females. And we learned that because of growth hormone signaling, that some gene expression patterns in the liver in females are different than males, and that directly impacts how some drugs are metabolized. And this is why it was a major problem until the passing of the Revitalization Act, when we often did trials only on men and male subjects. And then you have all these women with all these different adverse effects or birth defects and stuff. And so we now have to include women in research. But a lot of it was because people didn't know that there are definitely fundamental differences in how some liver enzymes are active in male versus females.
It's like, now that you say it, it's like, oh, well, that makes sense, right? But it's so, yeah, it's just crazy, isn't it? How something that could just be so obvious just kind of isn't. But hey, that's what it's about, man. That's what it's about, right? Man, that's cool. I have a degree in biology and chemistry. I wanted to go to medical school. I wanted to be. I thought I wanted to be a basketball player. Well, I'm only 5'7". And so and I thought, well, the closest thing to that is being like the sports doctor with the team. And so that was my thing. And then the MCAT, came into my life, and it changed my life. Changed my life to a new path.
I shouldn't laugh. I did not.
Oh, dude, hey, you know what? I'll tell you right now, it's all good. You know what? I am crap at standardized tests. I know it. I know I am. I always have been. I mean, I graduated like second or third in my high school class, right? I had, thousands of people that started because I studied, because I worked hard. Anything, like it doesn't. If this guy has more talent, I got this much talent, but I got this much effort, right? And you used to could do that, right? You could win a lot. You can win a lot of things with how much effort you put in. And that's how I got my grades and stuff. But I mean, I took the MCAT, and I'm not gonna tell you what I scored on it, because you could have like just filled in the bubbles like with your eyes closed and done better. And I thought, I'm gonna take the Princeton review, and I didn't go to summer school. I studied for the MCAT all summer. I went to that like it was my class, and I studied, and I took it in the fall before my senior year. And I thought, man, you know what? I was like, I felt good. I'm like, it was worth spending that money. It was worth studying all summer. I nailed that thing. I probably got about 24, 25. I'll probably get almost, I'm just going to barely, but I'll get in. I got the same exact score when I didn't even study. I just took it to see what it's like. And that was the message. That was my message, to say, you may want to be around medicine, but it ain't going to be like that.
Yeah.
So plan B was business. And hey, man, it's all good. I don't have any regrets. So then I got my master's, right? I got my master's, and the IT thing was hot then. So I had that. And then, I moved to Dallas, and, I got, I had a very, very nice starting out, base pay and salary than most other people did, right? And so that was my thing. Yeah, anyways. So, gosh. Now, UP, just for those people that don't know what that is the Upper Peninsula.
Yes, right? Yes. I forgot. I never see a Michigan person just knows it, and I did not say this. So yes, that's what we call the UP, or they're called Upers. The people that were called them Upers.
Oh, I didn't know that. That's interesting.
Yep.
Okay. Yep. Now these you do these exchange things, or these programs. Where have you been outside of the U.S.? I'm interested about that.
So I spent a year studying at the University of Sunderland. It's in the UK. The easiest way to describe it, it's about roughly 3-ish or so hours north of London. It's about 15 miles southeast of Newcastle. So it's pretty far up in the northeast. I can tell you the weather was not great. But not that it snowed, but it was, a lot of that wet, windy, damp, and cool.
Yeah.
And that was problematic for me because you remember I'm still an asthmatic, and while my asthma had gotten under control, when you're in that kind of weather all the time, I think I picked up 4 or 5 chest infections. I said,
Yeah.
I don't think I can stay here long term, but it was a great year. Made a lot of friends. Really great time. And now Sunderland just got re-promoted to Premiership this year, the football league. And so I've been watching. I'm like, yes, they're back, because it took them a while to get back up there. It took them a while.
Right. Wow, man. So you follow a football club because of the time you spent over there, right? That's awesome.
Yes.
That's cool, man. That's cool. I lived in Spain for a year, English teacher kind of thing. I took a year off when, after I'd been working for 5 or 6 years and traveled all around Europe. So all of Europe. I lived in New Zealand for 17 years as well.
Nice.
Loved it, man. Yeah. International. I would still be somewhere than the US, but with my health stuff and okay. So, tell me about the beginning, because what did you specialize in when you were like practicing, and what was that? Because you've moved into, you're full time with your nonprofit that you founded. Is that correct? Yeah.
Yes and no. I'm full time, but I'm transitioning.
Oh.
So the nonprofit. Well, how to describe it? So, because my undergrad is in mechanical engineering and my master's is biomedical and the PhD is molecular biology, I always knew how to navigate biomedical spaces, talk to people, present. And then I was trying to get out of the academic realm because I said, I'm not going to be a professor, because I was getting tired of that.
Right.
So I said, I was applying for jobs like crazy, and I ended up getting a job at the American Association for Cancer Research in the foundation. So doing a lot of biotech and pharma prospecting, fundraising, grant writing.
Wow,
and then after that, I took a position at the Lung Cancer Research Foundation as the director of scientific programs. So I oversaw the grant administration system, started liaising with the internal, external stakeholders and co-sponsored studies. And then I went to another lung award called Longevity, and there was a director of STEM workforce initiatives. So I developed a mentorship and training program for the diverse scholars that were clinical fellows. I did some stuff with some first-year minority med students to help them get summer research experience in thoracic oncology, with the hope that when they finish med school, they would consider thoracic as a specialty, because we just have such a significant lack of diversity in thoracic oncology.
Okay.
And I did 3 virtual health equity series. I did a Facebook Live, fireside chat, and webinar series there. And then I did some went out to different community groups speaking about cancer disparities and equities, and then speaking to diverse scholars about STEM careers, navigating career transitions. And these 2 things the STEM stuff I've done along the way, because I literally know what it's like to be the first gen scholar navigating stuff when you are not used to the space and how to jump through these hoops. So that was natural to me. And then after that, I finally launched the nonprofit, the SCHEQ Foundation, or STEM and Cancer Health Equity, to broadly work on trying to increase workforce diversity in STEM fields and to get more information and resources to help underserved populations better understand medical care and cancer care. And this really is a 3-pronged approach, getting kids to see themselves in these fields, helping them navigate those degrees and degree transitions and get them in the workforce. And then lastly, if they're in the workforce, then they can probably do work to advocate for these underserved populations. And on the same side of that, really trying to educate patients about how to understand terminology, how to ask questions, how to be able to get the care you're entitled to versus what they give you. And this was inspired partly because of what I saw growing up and how my family navigated or got mistreated in healthcare. When you talk to other Black patients navigating lung cancer, and they would say, well, we don't really see ourselves in the materials, on the websites, on the boards. And then just people having me speak about inequities, and they're like, well, there's a Black scientist that does this stuff. And I'm like, yes, we exist. We're unicorns, but we do float around. I'm halfway being facetious, but
I'm with you.
but when you go in that room, like I presented to groups in Flint and Detroit, and I'm from Detroit, and they're like, right. And they just light up like what someone that has lived experience that we can actually talk to and just shoot the breeze with them and just not come in with, I'm documented, but I don't go in with that. How can I help you? And what do you have questions about? And how can I just explain it? And so you have to sometimes learn to leave that degree in ego behind and just be a person.
Yeah. Man, there's so much in that. Now the things you were talking about when you were doing kind of the research and they said, where were you living? Where did you jump around? Like different parts of the country, or was this all around Detroit and New York? Or
oh my God, I have lived all over. Jesus Christ.
Good, man. That's so good. It's so good for you, isn't it? To get all those different flavors of things. I think it makes you more open-minded, and really, I feel like it makes you more intelligent, because I don't learn well in a book. That's how I learn. I want to try the food. I want to talk to the people. I want to do the custom. I want to have the misery of sleeping how they do it, or no air conditioning, whatever. I want to feel it. I want to do it. That's me. That's how I do it. So I love it.
I think it makes you more human. You learn more empathy. You learn more understanding. And at some level, even though we all have different experiences, we still kind of have the same goals and hopes and needs and wants. And you just have to learn how to compartmentalize it. So when I lived in England, I traveled all over Europe, at least Western Europe. And then as far as for my education, Jesus Christ, let's see. Undergrad was at Michigan
Tech. You can just kind of pop around if you like.
Yep. Yeah, I'm trying to think. Let's say Memphis. Okay. I've lived in, summer in Nashville, time in Madison, Wisconsin. Okay. Let's see, Miami, Berkeley, California, which is basically San Fran Bay area.
Right. Yep.
Philadelphia, Boston, because that's where I did my PhD. Of course, I live in New York right now, and I have lived in Portland, Oregon, I think. And then West Virginia, Beckley, because summer's in Beckley. Yep.
Okay, just, this is off topic, but what do you like? Which one do you like the best? What do you think? Which one do you like the best, and why? And I'm just random question. Where do you think you'll retire? Where do you think? What's that? Where would you have your dream home?
Okay, so first question, what do you mean, where do I prefer, U.S. or overseas? And then
open, whatever you want, whatever comes to mind.
So I've lived in so many places.
Yeah.
And I will say I really like New York. I grew up in Detroit, and that's a car dependent place. I love New York because you don't necessarily need to have a car. Yeah. There's always something to do. There's always something to eat. There's always something going on. And for someone with me with ADHD who sometimes just need a spurt to do something, it is great. There's a burgeoning biotech network and digital health network that is emerging over here.
Cool.
So that's what makes New York great. The things that make New York not so great are the cost of living and the rent. And that's just something you have to really battle all the time. But I've lived in many, but if there was anywhere in the US I'd rather be here. Now, Europe, that's a different story. I've lived in so many cities and they have been great for different reasons, but I do like Paris a lot, but also because I can partially speak French, even though it's really, really rusty. But I do love Barcelona. I've been to Barcelona twice. Okay. That is a fun city. I really love Barcelona. I really love Barcelona.
Yeah. I didn't know. I went and taught English for a year, the tutor thing. And it was just so cool. And, I'm a couple of English teachers, and one of them I got to be buddies with, and we would. And Barcelona was just wow. I mean, it's an international city.
Yeah. Did you do it? Did you do your teaching at Barcelona?
No, I did mine in Madrid, actually. Yeah.
Oh, okay.
Yeah, but we went on holiday. We went on holiday or weekend, 3-day weekend. to Barcelona a few times. Very international city, very different than Madrid. Very different. All the parts of Spain are very different, which is cool. Which is cool. I love it. I love it. I love the Spanish people too, man. They're just so, man. They're happy. They're just, yeah. Yeah. You know, they're all about, man. They you know, get up late. They stay out late. And that doesn't mean they're necessarily partying. I don't think they're not a bunch of drunks either. You know, they're social. You know, like they actually don't think, they actually look down on people that, you know, get highly, you know, extremely intoxicated like a lot of Americans do, right? They just, you know, they drink to just, you know, get smashed or whatever, instead of drinking as part of the evening and the night, right? I don't know. I just think culturally they're more balanced with that particular thing. Yeah, and I'm just curious. So do you think, like, when you retire or whatever, do you think that you would maybe have it like retire overseas somewhere or in the set? I don't know. I don't really ask this. I'm just curious.
No, I don't have an answer. And I really don't, because, you know, I still love living abroad.
Yeah.
And I haven't lived abroad in a while, but, you know, no matter where you are, you still have to think healthcare and how healthcare is delivered.
Right.
And, you know, a lot of places overseas have universal healthcare, but some people think, well, that's the end all be all, but it's not necessarily the case. But sometimes once you get to a certain age, then they can still withhold care or give you the bare minimum if you're a certain, because they don't necessarily, there's no impetus for them to make sure you get healed. So you're juggling that. And then if you're in the US, your issue is, do you even have enough money to get paid to be treated? Or what kind of bills are you going to have after you get treated? And I can't tell you that one system is better than the other. Yeah. One, yes, you don't pay for, or you already pay into socially, but then the other, you know, depending on what type of insurance you have, will tell what kind of care you get. And then actually it also tells, based on my foot stuff, how they might decide to treat or not treat you.
Right. Yeah, interesting. Did you feel like, you know, like in the UK, for example, when you were there and doing things, you know, like the you know, like, I don't know how to say this really, but like the racial kind of, you know, landscape, or, you know, did you notice that the English are like, it's more widely accepted that, you know, in the UK they don't care about the color, they don't care about that. I didn't get the feel in Europe they don't care about that really, in my opinion, in general, right? It's more like the people, it's the person, right?
When I was there, so that was 90. Jesus Christ, I gotta count years. I think I was there 97 and 98, and so. And, you know, and Sunderland used to be a big shipbuilding hub, and people used to say, oh, it's a bad place, you got to be careful there. But I'm from Detroit, so what's going to bother me? So I went, and it was funny because sometimes I remember this story. One day we were all, I think we were bar hopping or going out to a club or something. And one of the guys was a mixed guy, and I don't know why he did not realize I was American. And then we were walking, like, oh, how'd you pull off that American accent? I was like, huh? And we're all like, what are you talking about? What? Like, this is my accent.
Because he thought you should have had an English accent, right? Just like everybody else.
Yeah, and he said, like, whoa, that's a pretty good American accent. And I'm like, I hope it is, because it's me.
It's real.
But so I don't, you know, and Sunderland is, from what I remember, I can't remember if it was that diverse, but when I was there, it was fine. But everyone was in school and uni, and so we were all just going through. And when I went, it was not a great school. I mean, ratings wise, it was not considered a great school, but for some, I don't know what's happened. Somehow in the last 20, 30 years, the school is like a top-notch place. But they had beautiful campus. Now, when I went back a couple of years later, and the weirdest thing is I was just walking down the street, and some guy was just yelling at me from way down the street, and I wasn't paying any attention. And then as I get closer, he's trying to threaten me or something, and I'm just looking at him like, huh? And then his girlfriend is like, and then she realizes I'm American, and then she's like trying to get him to be quiet. I'm just like, keep walking. I'm like, you can yap all you want, long as you don't touch me.
Yeah.
Because then, at that point I was, was I doing jujitsu? No. Yeah, by that point I had started doing jujitsu. So
Wow.
I think so. Yeah. So
good for you. How far along have you progressed with that? Like, what belt are you?
Yeah. I had gotten to brown, and I still have my brown belt.
Wow.
But sadly, that was 2011, 2000. I want to say 2010ish or so. I had that brown belt, and I was getting ready to prepare for my black belt exam. And literally, I was 2 weeks away from my black belt exam.
Yeah.
And tore my ACL.
Oh.
Yep.
That's like a year and a half, isn't it?
Yeah. I had a lot of pain in the knee for maybe the prior year, and I thought it was just a sprain or a stretch, and I was using liniments, and I went to jump on someone, do my last throw, and I never finished my jump. And thank God I didn't finish that jump, because it would have been way worse if I had tried to do the jump and throw that I was about to do, and then it just popped. And that was a whole basically year rehab almost.
Oh, that's so tough, man.
And then never really got back on the mat. I got back on it here and there, but then I ended up finally having to stop practicing in around 2018-ish or so. Because I found out I have, it's one thing to be big and strong, but it's not good to be big and strong and have lax ligaments. So what that means is all those years of doing wrist locks, joint locks, meant I started opening the joints up a little more, and then having some more early arthritis because of all the locks. Nothing bad, but it's when you're flexible and lax, it's just not good for jiu-jitsu, because everything is a wrist and joint lock.
Right. Yeah. Are you a UFC fan? Do you like the UFC because of the jiu-jitsu, or you watch some MMA stuff?
In the early 2000s, when we were really going all out, and they had, I think, UFC and Pride, I was watching it a lot.
Yeah.
Because that stuff was crazy back then. And now they have more rules, but I don't watch it as much. Well, I don't really have cable anymore, but I watch it sometimes, but it just doesn't excite me like it used to. I'm not saying it's good or bad. It's just, if I catch something, I'll watch it, but yep.
It's just kind of gotten where it's like, it's so much, it's like every weekend, and it just gets to be like, you don't know the fighters anymore. It used to be like a thing, right? And it's like once a month you have I just think there's too many guys on the payroll now, but it is what it is, right? They moved to Paramount, which is cool. So it's not $100 every time I watch a pay-per-view. So I just wonder because of the jiu-jitsu and that. But I think it's a great discipline.
Yeah, back then we watched it a lot, and that was before. I think that was just around when Gracie was coming up and through and all that stuff, and then we had this whole phase. Everyone thought the Brazilian jiu-jitsu was the only thing you needed to do, and I'm just like, can be effective. It is great. It is great mat work, but you have to be aware that not, even though this whole adage that all fights go to the ground, you don't really want to be on the ground if you can help it, because it's not the person you're fighting, it's how many other people are with them, and you have to be worried about that, and you cannot, I'm gonna choke you out, like
right. Yeah, I'm with you. Yeah, 101, okay, but
yep.
a lot of them are like that, especially when the other guy's losing. When they see his friend losing, right? Well, cool, man. So the asthma thing and that kind of stuff, is that what kind of drew you to more of the lung kind of research and the lung cancer thing, or is it just coincidental?
Partially, it's coincidental.
Okay.
Now, like I said, my dad was a chronic smoker, and we would go to his house and leave feeling like cigarettes, and it drove me crazy. And one of my earliest science fair projects was we had these how to describe it. We have all these corner stores, and they kind of know the neighborhood kids. And so I would go to the corner, and so I didn't know how I found this, but I found some way to order a kit where you have like this, like there's a rubber bulb and an apparatus, and then you can have filter pads in it, and then there's a bulb here, and then you can put a cigarette in it, light the cigarette, puff it with the bulb, and then capture the particulate matter. And so the goal was to try to see the amount of tar and nicotine in different amounts of cigarettes. And I think I was able to show that Camels had some of the highest particulate matter. And then cross-referencing that, I got a lot of materials from the American Cancer Society. And at that time, they had all these images of throat cancer, tongue cancer, and all these things. And I put those in my poster. And then I did not know I was going to end up back in lung cancer. I think I did that in 6th or 7th grade. Wow. But then in 11th grade, my science department head at my high school told me about a summer research program at Michigan Cancer Foundation. And so I applied for this apprenticeship, and then I got my very first real lab experience working with some like 60 anti-cancer drugs and testing them in different leukemias. And that was 11th grade. So that was sort of, this is stuff you can do. So when I knew you could apply for these kind of programs, that's how I started to do all my summers doing biomedical research. And then I still didn't know I was going to do a career in lung cancer because, the undergrad was in engineering, and then the master's is in knee ligament biomechanics. But then when it came to PhD lab, the lab did a lot of stuff in cancer and broad therapies. And I ended up doing a project primarily related to lung cancer.
Okay. Wow.
Yep. So it was not a directly linear path to lung cancer. It just, the lab I happened to be in did a lot of stuff in combination drug therapies. And like I said, I did my PhD in lung cancer, did some postdocs in musculoskeletal biomechanics, and then back to lung cancer again, and then breast cancer. And then I was just doing general stuff at a nonprofit for fundraising. And then I ended up working at 2 lung cancer orgs. That just happened to be how things shook out. So I was able to leverage my skill set of the bench work to do patient advocacy. But then that turned into people asking me to speak to underserved populations about lung cancer disparities and inequities, trying to get information and resources to them. And then that eventually turned into me launching my nonprofit to focus on getting more information to Black and Hispanic patients to help them understand and better navigate lung cancer and know how to ask questions.
How long have you had the nonprofit? When did you start that?
August of 2023.
Wow. Okay, so that's it. Yeah, and I looked at your site, man. I mean, you've got like 15 people on staff, and I mean, that was just like director people, management people, right?
I don't have 15 people on staff. I just have a lot of people that have engaged with my stuff.
Oh, okay. Well, it's on your website, and it looks like they're involved, right, with your nonprofit.
Oh, that was my conference. That was probably a picture from my lung cancer conference.
Okay.
They're all with their hands out. That's probably a big picture from my lung cancer conference. That was probably.
Yeah, and how do you say the name of your group?
SCHEQ. SCHEQ. Okay. So it's like SCHREQ, but without an R, and that stands for STEM and Cancer Health Equity. So that's what it stands for.
Gotcha. And did you ever have patients like that? Because I feel like you've mainly kind of been in the research sector more.
I've been in the research, but trying to do more education. So for our lung cancer conference, we make sure to try to bring in patients, caregivers, and survivors. We try to provide those infographics to break down medical and cancer information. We try to include diverse representation because often our underserved communities don't feel seen or heard or acknowledged when they engage care. And so when you don't see yourselves represented, why would I want to engage or listen to the doctor or the provider? And this is also why we then end up having low enrollment in clinical trials, or patients aren't offered biomarker testing or the latest advances. But, it's a whole feed forward mechanism. So part of my work is to try to break down these barriers and help these patients better understand it, navigate, and ask for the care they're entitled to. And like I said, and once we talk about the stuff with my foot surgery, which was not why I launched a nonprofit, it'll tie in so well to why it's important to be able to advocate.
Yeah. I don't know if you really looked up much about me, but, I've had cancer 3 times, hip, lung, and pancreas, 2019, 20, and 21. Obviously, all of them were life-threatening. The pancreatic, I'm not supposed to be here, right?
Pancreatic is pancreatic, bladder. Those are things that often don't show symptoms until it's way too late. And so
I was living in New Zealand and I got the hip thing, and that was about, oh man, I mean, a 6-month ordeal just to get the surgery, then 4 or 5 months with the whole surgery thing and all that. It was infected. My leg was shorter than the other. They wanted a hemipelvectomy. I mean, it's a train wreck, man. It really, it's so bad. It's so bad. But we'll talk about my little thing eventually. With my hip, I just want you to see kind of some of the x-rays and I think you'll think it's cool.
I probably will.
Yeah, I think you will. I mean, like, I mean, almost every one of the orthopedics that has seen this stuff, they're like, this is like, it's cool, man. It's cool, Yeah. So, anyways, right. So, now, I had a business in New Zealand. I was popcorn. I had a kettle corn manufacturing business of all things. And they didn't have salty sweet popcorn down there. And I met a guy and we started a company, and it grew from going out to local markets into this big manufacturing thing with a couple of plants, and we shipped all over Australasia, and I went to shows and blah, blah, blah. And then the cancer thing happened. Right. So, yeah. So I'm with you. I have a big heart for patient advocacy and speaking up for yourself and doing that. And, this podcast is, that you're my guest, but it ties in. I mean, I even have like a short download for people. That's like my quick kit of just like how to go to the doctor and get the most out of your doctor's appointment. And people laugh at it. They're like, I don't need a guide to tell me how to go to the doctor. I'm like, did you forget to ask some of the questions that you remember that you thought about after and you had to schedule another appointment? Yeah. Or did you show up and you had the appointment and then like you get a bill in the mail because they're not in network? They're like, yeah. I'm like, see, that's what my little guide does. And they're like, oh, because, for me, in my opinion, there's 2 ways that you enter the healthcare system, right? An emergency or most people, you start with your GP, right? And so you get your information, you go there and you get your 10 or 15 minutes, man, and you maximize that and you find out what you want and you make it a good, you may not find the information you didn't want to know, but you get it and you have it, so I'm a big patient advocate guy, man. I mean, I'm a cancer journey coach and patient advocate thing. So I love the stuff that you have on your site. Yeah.
Oh, thank you.
Absolutely, man. Absolutely. I mean, like, I don't know. There could even be something there for us to work together on some stuff. I mean, like, I don't want to feel any pressure, but I'm like, this is like right up my alley. I mean, and this guy, he's got the blue thing.
But it was literally just born out of just the frustration of, my mom would go to the doctor's appointments and then, they would never really tell her stuff. And it's in my chart. It's like, if you can't take the time to explain to a patient what the follow-up is, why would you think they will follow up? And then when you are a patient that doesn't really read medical jargon, you're not going to get to page 5 of my chart because you're going to be so confused. So this is why we make the infographics, slowly trying to break down this terminology and then we do the stuff on a cancer and a disparity in those cancers. So we can just show you, maybe how one community might engage care, sort of how you can start to feel more comfortable in navigating this stuff. And eventually, if we get enough funding, then we can start building out more comprehensive cancer portals. But it's just it's a tough environment right now trying to do work for underserved communities in cancer. It's a tough environment right at this moment.
And I fully agree with you that minorities have it worse. But you know what? I think patients in general have it bad. I don't, and the people that are they're our age and older, like they were taught, right? You listen to your doctor. You do what your doctor says. If you get a second opinion, it's disrespectful to your doctor. If you ask him questions, it's disrespectful. And it's like, man, it's not like that. You got to, it's your life. I had an epiphany moment when I was in New Zealand on the phone with my parents during COVID, and I had been to about 8 different, all of my surgeons in the public, my orthopedic, they all were like, "You're not going to make this. You're going to die from this," and they're like, "You're dreaming that you're gonna beat this," kind of a reality check to me, because I'm like, that's what I was doing. I was like, no, I'm gonna be part of that 5%. I'm gonna be, and they're like, yeah, appreciate it, Trent, but we've been with you for 2 or 3 years, and your folks are lovely, and you really should leave New Zealand and go home and be with them for the last year of your life. And I'm just like, I mean, I ran out of people, and then I booked appointments all in the private sector, and I got the same thing. And I was like, I guess you're right. I have no one left here to be on my team. No one wants to be on my team anymore.
Yeah.
So I came to the States, and luckily, I found some people, and it has put me on this pathway. I mean, you could check out my site, TrentBrockCoaching.com, man. I do my little coaching thing, but it's about advocating for yourself. And man, it's just a little tweak, right, in the mindset and doing it. And I think it's between, it really can get down to life and death, right? It really can.
Yes.
It really can. Let me ask you about this situation that you had recently. I looked it up. I kind of read about it. It was posted in an Instagram post about your foot and the discharge papers and kind of what happened. And I'm blown away, okay, by what I read, that a medical professional, and one with your qualifications, right, is treated like this. I'm blown away, right? That kind of opens it up. Would you please?
So I will help give your audience some context.
Please.
So, we always talk about how Black and Hispanic patients are treated in healthcare. And some people always say, well, that doesn't happen. And I will tell you it does. And I'm not naive or any stretch. We're just used to being ignored, disregarded. But like, if you think about Serena Williams and her almost dying from pulmonary embolism because they wouldn't listen, and Venus Williams with the fibroids, and then there's me with my foot. And I'm not saying I'm special by any case, but if basically my example is, if I'm one who works in the workforce, knows how to advocate, knows how to read records, had everything planned in place, but the hospital still decides that I am not valued or important because I'm apparently on Medicaid, which means I'm poor and uneducated and unaware. It's a more permissive problem in healthcare in general for all other underserved. So in my instance, what happened is I had a slip and fall and fractured my ankle at the end of December of 2024.
Okay.
I was basically in a boot for about the first 6 to 7 weeks of 2025. In between that, my mother had been in the hospital most of the back half of 2025 in Detroit. She ended up dying in January of 2025. And then I still had to go bury her in West Virginia on one foot in February. So I still had to try to somehow put together a viewing in Detroit that I could not go to. And then I got her to West Virginia, and I went down there for that funeral. And then right before I went down there, the surgeon basically said that there was an opening in March for surgery. So basically, we had the fracture of the ankle, and it was a pretty bad fracture. I mean, if I didn't fall the way I had, I would have also destroyed my knee and hip. So the ankle took the brunt of that fall, and that was just those years of jiu-jitsu kicking in. So the fracture healed, but there was enough extensive damage that he said, well, we need to do reconstructive surgery of the foot, get rid of all this bad bone, arthritic bone, and all this other damage. So we had to do reconstructive surgery of the right foot.
Wow.
And the surgeon and I had a comprehensive plan with the surgeon. My issue was not with the surgeon at all. He was a chair podiatrist. He was a great, phenomenal doctor. Awesome. And he listened to me, and I understood everything, and I had an ACL, and he knew I had a biomechanics background. So I just asked him, because I knew what kind of pain it would be. I said, can we just put me in skilled nursing for the first 3 weeks or so? Because, I live alone. I don't have any family in New York. It was virtually impossible to navigate my apartment that first week when I just had a splint in the crutches. So now you're going to do surgery where I have to be non-weight bearing for 6 weeks in a cast. And, so it's impossible to really hop on one leg and have two hands on a scooter or a walker. And then you can't cook, you can't clean. And every single step or hop is extremely painful. So I just rationalized, could I just get skilled nursing because I don't have anyone with me? Right. And he concurred. And so that was the rational part of the plan. Sure. We did surgery that Thursday evening, and we ended up starting late because the surgery bumped us. And we were supposed to take roughly 2.5 hours. It took about 4.5. And so I think we got me done with surgery around 9 p.m.-ish. By the time I got to step down, it was around 11 p.m. And he said, well, because it's late Thursday night, and it was literally after work, official work hours, there was no way there's going to be a skilled nursing placement for me on Friday. So he said, we will work and process this on Monday. And he said, we'll just have PT come do a skilled nursing assessment. And, and so I was like, okay, so I had no issue there. But then that physical therapist comes in Saturday morning, less than 36 hours after surgery, has horrible bedside manner, bad attitude, just dismissive and rude. And I could sense that. Now, mind you, I'm all on opioids, but I can sense people.
Oh, yeah. Okay. Yeah.
And she was just evil and just condescending. And I'm telling you, it's non-weight bearing. I'm not supposed to be on my feet. So she tries to force me to walk or hop on this walker. Now, this leg had surgery, the right leg has surgery. So you want me to hop on this left leg that has the left ACL reconstruction. I have flat feet on the left foot, and I have a cast on the right foot, and you want me to hop. Now, every single step is unbearably painful because blood is rushing to the foot. And I'm telling her I'm in pain, and I'm scared for my life because I shouldn't have been standing because I'm a fall risk at my weight and on opioids. What does she write in my medical chart?
You were combative. You're a bad patient.
She wrote in my medical chart, which I only read 3.5 weeks later, patient has no pain and can ambulate. Now, you can probably tell what that then tells insurance and all this other stuff downstream.
Right. Yeah, you're screwed.
So I didn't know that's what she wrote.
Oh, God.
Because I wasn't reading my charts because you're in the middle of stuff. You're thinking you're going to get moved on like your surgeon said, but apparently PT and hospital staff can make their own decisions that are not guideline concordant. And so I had a medical proxy who was in Florida, who I know very well. She's a nurse. And the reason I had her included is because I have ADHD. My brain is always on fire. And I knew what I was going to be like after that surgery. And I knew I was just not going to be there. So I had her listed as my proxy. They never called her. And they use this thing called alert times oriented times 3. So because I could tell you the day, the time, and where I was, they said, oh, he's alert. So that whole first 3 days, they had all kinds of people in it, which I was not keeping track of. But oh, well, patient agreed and patient said, I'm like, I didn't say or agree to any of this. So they're trying to use that as their basis for not calling my proxy, which is why they did all this stupid stuff. But she lied in my records. The OT then also wrote patient has no pain and can ambulate. I'm like, when I'm reading this weeks later, and I'm really annoyed because you had no reason to fundamentally lie to me, except they saw this, oh, Medicaid patient. We're just going to push them out the hospital. That's the official goal, to push you out.
Did they know that you were a doctor? Did they have any clue about that?
I don't know, but I think I said I had a biomechanics surgeon, but but they still ignored me. And then they still ignored the surgeon. They iced the surgeon out of the medical records because he doesn't have direct admitting privileges at that Mount Sinai hospital. So yes, that was Mount Sinai, Queens. So
wow,
he was incensed. I was upset because I'm thinking I'm getting the skilled nursing. And they said, well, and they're coming up, well, he doesn't deserve. So they're coming to all this up what they think I don't deserve. And I'm like I'm sitting here having a party on one leg. Like, really? I'm really not. So between that, then that evening, a nurse tried to give me a discharge notice. Now, as now by state law, you have to give some patient a discharge notice at least 24 hours before you can try to release them.
Okay.
They tried to give me that discharge notice 6:30 p.m. Saturday evening, less than 48 hours after surgery. Now, mind you, I've not had follow-up from the surgeon or his team yet.
Right.
I've not seen a caseworker or a social worker.
Yep.
And I said, I'm not signing this. So the nurse wrote, patient refused to sign as the person, and then wrote relationship of self, and then it had that date. And then I looked at the time, I said, the time written on that paper was written for 9:35 a.m.
Can I ask you?
Yes.
Yeah. Now the reason the doctor went around is because it was the weekend. So that's just they were kind of like, wait till Monday. Is that what it was?
No, it was clinic hours on Friday. So he wasn't going to be around, and then he wasn't going to be back around on Monday. So so it wasn't that he forgot about me. We sort of had the plan in place that we thought was going to happen. It wasn't he neglect. No, we had a working agreement, and so I had no issue, but the whole staff decided to interject and cover up and mess up and obfuscate things, and I did not know and expect this. Wow. And so so when she wrote that in the chart,
what does that mean? What does that mean about the self thing when she wrote? Can you explain that a little bit?
So basically, there's a you get a form that they have to give you when they're going to try to discharge you, and typically you have to sign it as you the person has to sign it, but they wrote patient refused to sign because I didn't sign it. And then there's a line for relationships. So it's either yourself or advocate or whatever, but they wrote self. So they wrote self as if it was me writing it for myself, but I didn't sign self.
Oh. Oh my gosh. So it was like forgery.
Yep. And then and then the time written on that sheet, it was written at 9:35 a.m. They had wrote it for 9:35. It was not given to me until 6:30 p.m.
all day. Yeah,
so you can see where this. So you have to have this notification by 24 hours in advance. You give it to me 6:30 p.m., but you written 9:30. Well, if it's charted, it's going to be charted at 9:30 a.m. and not the 6:30 p.m. you gave it to me. Right. So then it's on me to try to appeal to insurance by noon on a Sunday, which we know is not open. And they had 3 different insurance numbers, but none of them were XR for me to dial. And I'm like, I'm not doing this. And then that is when I called my medical proxy, and she gave the nurse a piece of her mind that this is illegal. There's no caseworker, no social. He's seen none of these people. You take that damn piece of paper back. And that's the only time my medical proxy got involved. And I had to call her to get her to do it. And then I got labeled a troublemaker. And then on that following Monday, the hospitalist asked about my ability to pay for skilled nursing, which I'm not sure if that's your job. Why does it matter if I can or can't pay? That's not remotely.
Yeah, right.
in your job a role in care delivery. So it was a whole concerted effort by all of them to just keep pestering and lying and misrepresenting. And I was just frustrated. At that point, I did start crying. And she wrote, when patient asked about their ability to pay, they cried. I'm like, what? That's what you wrote in the chart? I'm like, you as opposed to all the stuff you've ignored, every single thing I've said. Your PT and OT think somehow I'm able to walk and go home, even though I live alone and I can't navigate this. And I've told you this. And you think because finally on day 5, I can use the walker and get halfway down the hall that I'm good to go home by myself. When you have at least someone on the side of me when I'm in that hospital. So yeah, and then I ended up having I had the first blood thinner, and that had my liver numbers out of whack. And then we ended up doing ultrasounds and stuff. And then we switched to blood thinners. I came back down. And then now this PT, 5 days, she didn't respond to the surgeon. He wanted a reassessment. She did not answer him until he finally complained up in the system. And then she said, well, I'm not changing my evaluation because this is what I think. I'm like, oh, so now our physical therapists in the hospital know more than the chair of podiatry. And but because of that, the surgeon lost his peer-to-peer to get me the skilled nursing. He lost his peer-to-peer, not because of the need, because even the insurance officer was like, I don't know why the hospital is doing this, but because PT and OT said patient has no pain and can ambulate, that was the basis that insurance couldn't overrule that. So basically, they blocked me from getting skilled nursing, and the surgeon couldn't do anything. So he had to appeal just to give me some hours of home aid, and I only got like 3 days. Now, this same physical therapist, oh, well, if you agree to go home, we'll get you home aid. I'm like, if I knew you were lying, I would not have trusted you at all because you clearly didn't want me to get anything. And if we had listened to you, I would have, if the surgeon hadn't fought, I would have been home all alone for all that time. I ended up being home 3 weeks before friends even showed up, and they couldn't even believe I was at home in bad shape. I mean, and I'm pretty resilient, but I'm frustrated, angry, mad, in tears because I'm like, I have never been just so disregarded and felt so empty and useless, well, for lack of a better term. And it was just frustrating because I could not really move, and it was so much painful. And I should have been where I had help, and they elected to decide they were going to make their own medical decisions for me. And then even on discharge, they wrote that patient has a caregiver, which I don't, which was the whole reason with me trying to get skilled nursing. And then they tried to push me out the day. And well, we gave you a scooter on the last day. I said, you should have gave me a scooter on the first day, not this walker, which is what we didn't want. You should have got me into skilled nursing. And so what this taught me is that don't trust anyone in the hospital. And I hate to say it this way.
Oh gosh.
If you ever go in for a procedure, and I made a whole blog about it, make sure you have a medical proxy in real time that can read your records. Make sure you know
you mean like a support. You mean a support person, right? That's what you like in layman's terms. Yeah, a person that is going to act on your behalf and review your stuff and is not under the influence of the middle of the procedure. I'm just trying to make it really simple for people because they were like, a proxy. What is this?
A medical proxy. Yeah. You are within your right to, if you are being mistreated, ask for the nurse supervisor, the CNO. You also can ask for patient advocacy, even though that hospital patient advocacy didn't do anything. I called them twice after I got home. They never returned a phone call. Whoa. They only returned a call when I finally sent a certified letter to them, the chief nursing, the chief of the hospital, the chief medical officer, the chief of podiatry, and the chief of surgery. Then they finally called me. I'm like, oh, you could actually return a phone call. Like, so what are you doing all these other times? So it was a collective whole thing of just inefficiency. And so what I teach people now is, have a proxy, make sure you read everything in real time, and make sure you document every inaccuracy and call it out. Make sure you then, when you are ready to report, you keep meticulous records. You report to hospital leadership with certified letters, so they have to acknowledge they received it. Make sure if it's a Joint Commission accredited hospital, you can file with the Joint Commission on Hospital Accreditation.
Right.
If it's you can file with Medicare, Center for Medicaid Services for Medicare fraud. or Medicaid fraud, you can file with Office of Professional Discipline, specifically physical therapists, occupational therapists.
Yeah.
They have standards they're supposed to adhere to. And if they don't, you can file complaints because no matter what the hospitals, you still have to do what your standards say. And nothing was guideline based on their behavior and what they did to me.
Yeah.
And then you can file with your local representative. So, and I teach people how I made a whole thing about how to do this and who to file with and how to report it. So it won't help me, but maybe it'll protect other patients because literally the day after I got home, I still had to go get my own prescriptions because, mind you, I can't walk and I'm trying to use a scooter. I didn't get 40 feet from my building and fell. So I said, nope, we're not do mail delivery if you're on Medicaid because they probably assume you're going to either, take an opioid or something like. So now I have to call my friends.
Sell it or.
So then I had to get my friends basically to go to the pharmacy every 4 to 5 days to get me different things. So I just could not do anything for those first probably 6 to 7 weeks easily. Yeah. And that happened to me, which is not the issue. But I think of all the other poor, diverse, underserved, marginalized people that are in that hospital or other hospitals systems, and they don't even know why they're getting pushed out or how they can advocate, and how many people are ended up readmitted or having complications or subsequent injuries because of nothing of their own fault.
Yeah. I'm just blown away that this is something that you are passionate about and that you do, and it's like it's on your website, and it still happened to you.
Yep.
It's crazy. Do you think that did they have something? Do they have something against you outside of? It just sounds like a concerted effort about we know who this Dr. Manley is, and we don't like him for what. It just
and it just started from the physical therapist that first morning. She just had horrible bedside manner. All they can see in the chart is Medicaid. That's all they can see. And then everything Medicaid, Black and poor, and they just sort of went with that assumption. But regardless, I don't care what insurance you have or don't have. Every person in a hospital system deserves to be treated with respect and dignity. That's the bare minimum. But unfortunately, we're seeing a workforce in medical care that's becoming less diverse. And a lot of the people are coming in are from the suburbs or from overseas, and they don't really care about people in the inner cities. And then they go back to their happy home, and then these people that really need help are just treated like crap. And then there's no empathy. And then we have doctors that don't even look like the people, which you don't necessarily need, but you need to actually halfway care. Sure. And but just looking at how my mom got treated, a lot of times I'm not sadly surprised.
It's just I think your superpower is having your support person like that. I mean, that's your gold, man. I mean, that's your backstop. That's your protector. I mean, that's your offense. They're everything. They're your utility player, right? You know what I like to do too? I take photos. I take a photo of stuff because you are, man. Coming out of surgery, and you're not right. You're not right. And so you know what? I'm like, if I get pushed into something and I have to, I'll take a photo. I take a photo of everything, right? Because it's just on your phone. You don't have to carry all the papers and all that crap anymore. And let me ask you what you think of. What about recording a conversation that you think is important? Do you have an opinion or a feeling on doing that, or would you encourage people to do that? Or
repeat that again?
Yeah, like an important doctor's appointment or something. Would you advocate that the patient records that on their phone and just says, "Hey, doc, I would like to record this or whatever"?
I think it would be great to record. That sometimes gets into state laws about recording, sure. And so it's not. On the one hand, yes, you want to protect yourself, but at the same token, you still have to
abide by the law.
Abide by those laws, and so some places you can't record legally, or legally, you can't either openly or hide recording. So I think and that is best to have someone with you that can understand and help ask questions on your behalf if you're not comfortable with asking. But I think, as you have mentioned, every patient should know or have a guide for like things you should go into your doctor's appointment with.
Yeah.
When you go, like, what issue do you have? What do you want to answer to? Do you want to know what kind of treatments are available? What are the alternatives? And then, if I don't trust your opinion, where can I get a second opinion?
Right.
I'm making a whole sheet on what to do when you go into surgery. Just
precisely, man. I mean, I've learned so many things. You know what? One of the most simple things is, man, I just shave the whole area in just an area, because, man, don't you know how bad it hurts when they rip the hair out with the tape?
Oh my God. I know.
It's just stupid. It's stupid.
Oh.
I mean, the night before, man, like my hip, I mean, I shave myself from here because I mean, on top of that, you just look at the tape and your hair's off.
And you think, like, I don't think this is Nair.
Yeah, man. I mean, and you know what? A couple of things. I mean, I've had some stints in the hospital, like you did when you were a kid. You know what? I tell people, take a couple of things from your room, like. And you know what I have in my room, I have like a couple of the pictures and stuff. They're with that sticky tack. So I just take them and I put them up on the wall, like my vision board. Or I have a painting of a warrior that a friend of mine did, and he has a Bible verse on it. And I put that on the wall. And I bring my little fan, right? And a couple of those things, and you kind of make it into your room, and it makes it feel more homely. And I think that helps you heal better.
Yep.
Right. I do. It's simple. People are like, why did you take that? It's like, because I want it to feel like home.
Yep. Anything that can put you at ease, no matter what it is, just use it. Because navigating care and recovery can be quite isolating and frustrating and angering. And so, how do you try to keep the motivation to keep going?
Yeah. Yeah. And the thing is, people may be honest and intending to do the right thing, but we're humans and we make mistakes. And so you can't ever let your guard down about just double checking, like the saline, right? Or like, can I just have a look at the syringe and make sure that's the right stuff? And we all just, it's just checks and balances, and you're not there to bust anybody, right? Yep. You're just trying to prevent issues. It creates an issue for everybody, right? And a lot of times, unfortunately, when you're the patient, you will be the consequences of the mistake. And it doesn't matter who did it, because they're sorry. Saying I'm sorry and going home and eating dinner with your family is way different than you being the one that's stuck, right? Not able to even get to the bathroom because your foot and your leg. I mean, it's just, you know what? You've been in it, and man, I mean, it's just the empathy, right? You've been there. I mean, you think it, and then when you are that, you just and man, it is lonely. It is scary. When you go into the hospital, you just have to continue to be vigilant. I think people get comfortable, they let their guard down, and they just trust, and hand it all over. I just,
Yep.
You gotta find the balance. Yeah.
Do some discernment. Make sure you protect yourself. Typically, people with a lot of money don't tend to have to worry about these things, but the rest of us do.
Right, man. Right. And I don't care, what hospital you go to or what. Mistakes happen. Human beings make mistakes, and it's just tragic. I had an unbelievable mistake happen with me. They misread one of my genetic blood tests and told me that I had hemochromatosis, and really I had cancer for 2 years. I didn't even find that out until the middle of 2024, 6 years later. And then I had to go to therapy for 6 months because I'm handicapped. And I lost my business. And
Yep.
I had to sell everything and I had to come home and live with my parents.
Yep.
My whole life is totally changed because of one blood test. They didn't want. They're like, genetic tests are genetic. They don't change. They don't, right? Well, they only change if it was a mistake.
Yep.
And so anyways, so I feel passionate about patient advocacy.
Yep. It's so important, and so many people don't know how to navigate, know how to ask questions, and how do we try to help alleviate those things for them. That's what we try to do.
I am so with you, man. It's like people, they have the energy, they have the desire, but they're confused and they're just overwhelmed. And it's like they just need some instructions and some guidance. And I don't think it's not that hard. And man, if you don't care about your life, it's the most important thing on the planet. And the person it's most important to is you. No one cares about you more than you do. And for me, it's like, you know what? It's okay to be all about me when it's this. You can't be. That's not selfish. It isn't, so man, golly, we've been rolling, man. We've been rolling. Yeah, it's been good, man. It's been awesome. Thanks for your time. Do you want to talk about the ADHD thing for a minute, or
we can spend a few minutes on it? We can spend a few minutes. It's really I
know the same thing happened. Yeah, same thing. So yeah, go ahead.
So I had undiagnosed ADHD, but that's not surprising because in the 80s we didn't really have an ADHD diagnosis. We just had to work through it and deal with sit down, be quiet, and you got to keep it together and don't act up, or you're not going to amount to anything. And when you have undiagnosed ADHD, it manifests in so many different ways. And you don't know which type you have. And I was more the inattentive. Okay, I'm a little bit of a basket case, but I'm not completely super hyper. But it showed up in how I responded to different things. So everyone else would respond one way, but my brain just would like, well, why are we all doing this? And why are we doing this? And I would always ask why. And, it's like, just because everyone else I'm not going to do it. Or I could see death or, go to funerals and I just wouldn't cry. And it wasn't because I didn't care. It was, I saw that as a manifestation of life. It ends in death. But it also made it tricky because, I have weird interactions with people. I just will say, first thing that comes to mind, and I'm notorious for interrupting people in conversation. And it's not because I'm trying to be rude. It's just I have something in my mind and I need to get it out before I forget. Or often we try to say something that lets you know we not so much empathize, but we sort of feel where you are. So we always try to come up with something to relate to what you're saying. And sometimes people find that off-putting. And then, but the hardest thing is, going through academia and, and I used to super stress about grades because I got good grades in high school, then got to college and was just super stressing and almost burning out because I could just never get the A's. That wasn't bad, but it was just extremely stressful. And I didn't get diagnosed until my grad school. And that was problematic because my undergrad was on Lake Superior and it was very long winters. And I didn't also realize I had seasonal affective disorder.
Oh gosh.
So, ADHD and seasonal affective, and not knowing you have either, trying to go through long 6+ month winters. It was a challenge. So when I finally got diagnosed in grad school, it made some things make so much more sense to me. But and even as I go through professional careers, it's still hard for me to do interviews, not because I'm a bad interviewee, but I don't like these basic questions that you have to answer to fit what's comfortable for a company. Like that doesn't, really tell me how you think or how you operate.
Yeah.
Or, are you a team player? Well, what's a team player? And, and you just see the big picture, and then you say, well, this is the big picture. Then we can do small pieces. But most people are afraid to get to the big picture. Like, well, you're too ambitious. I'm like, it's not about ambitious. It's just how I see problems and how you then can piece down and solve them. And then trying to sit in labs doing experiments when I didn't want to sit still, that was a challenge. So, like I said, I didn't get diagnosed so late in my PhD, but it made so much of a difference. So we don't like to, so I don't like to be micromanaged, which I'm like, my thing is just tell me what you need, when you need it, and give me my guardrails before I start. But don't let me start and then we'll need this and changes. I'm like, but but and this is also plays a role in executive leadership. Neurodivergent leadership is so different than everyone else. Everyone else is afraid. If the boss says, well, do you have any questions? If I have a question or statement, I'm likely to say it. But then if you don't want me to say it, then don't ask me to speak because I won't.
Right.
But it's really hard for us to work in hierarchical systems because they are by inherent design conservative. And they're meant to not buck the system or change. And it's hard for an ADHD person to sit there and not speak up when there's something that we know needs to be changed.
Right. Yeah. You feel like you're not being true to yourself.
Yep. Exactly. So that's my whole little mini ADHD diatribe.
Cool. Yeah. I appreciate that. I got diagnosed about 2 years ago. And then it was like the whole medication thing. It took 6 months, man. And I mean, there was some of that stuff where I was like, this is so bad. I'll go back to where I was. That was better than what, because some of it like threw me way out with anxiety. I mean, like weird. Like I'd have a meltdown, but because I was home by myself, and like my parents came home and just got home. And I'm like, what's this? You know how it goes, man. You're dealing with all that stuff, but you tweak it, you tweak it out, and you get it right. Oh man, I can't believe how many years that I just swallowed that, man. It was So,
and you have some messed up relationships, and not because you didn't care, but random outbursts or just being blunt when you don't mean to be blunt, and and sometimes that emotional, for lack of, is it emotional dysregulation? That's not the word I want to. It's that's sort of the first thing. If you feel attacked because you always so used to being told what you can't do, you're gonna fire back. So like, let me walk away, think about what I really want to say, and then come back calmer. And that's that, learning that emotional intelligence.
Yeah, man, I'm with you. It's yeah. Well, appreciate you being honest about that and bring it up because a lot of people are embarrassed about that kind of stuff. I was kind of ashamed at first, right? And it took me some time. I had to work through, all that, and and then the part about like I can't believe this many years I knew something was there, and like that's why I thought like this and no one else did, kind of thing. It's like, and then it's like, no, I'm not weird. I just don't think that way. Maybe they think they're wrong. Maybe they're weird.
And it takes a lot of time to get used to that neurodivergence and not thinking of it as a deficit.
Yes, because that's why society kind of puts it to you. And I love the fact that like some people, they even say, well, like it's actually a talent. I mean, it could be a superpower gift, right?
Yeah.
And so I just love the fact that you can turn that and look at it this way instead of that way. Then it's always just,
Yep. At the end of the day, the easiest thing I can say is at the end of the day, you cannot control what people think about you, say about you, interact with you, but you can control how you talk to, interact, treat people. because people always remember how they felt when they were in your presence, whether, as a friend, as a worker, or as a underling, or as a boss. And, if you're a horrible, condescending human, well, no one really wants to deal with you. And so you don't need to be in my sphere of existence. And so because I grew up in Detroit and learned how to get out of the bad neighborhoods and environments, I learned to keep the energy away. It's like there's enough going on in my brain that I have to keep chaos.
Right.
Extra chaos out. Yep.
Awesome, man. I have thoroughly enjoyed talking with you and appreciative of your time and sharing. Is there any thing you want to say, kind of wrap up? Anything about your website or any advertise, anything you want to promote? I mean, I'm all good with any of that.
Yep. I want to say thank you so much for having me on here. It was a great conversation. We probably had the most ADHD type conversation that you will probably ever have on your show.
Well, I feel like I'm a little more than you are.
Yeah, I sort of can keep it sort of down. Sort of.
Yeah. I mean, I got to interview Neil deGrasse today, so.
Yeah. Oh my God. Anyway, so
I'm sorry, man. I'm not trying to embarrass you. You can please, seriously. That is such a compliment. It really is amazing.
Oh, I know, and I'm just, and I'm so deflective. So you can find us. Our website is SCHEQ.org. We have our patient resources on our patients page. So we have the infographics. Cool. You can find about our lung cancer summit on there. And we typically do some lung cancer webinars, though I've been behind because of all the chaos of the past year. We also will do workshops, training sessions, develop mentorship programs. And I'm also on the side. Oh, our handles. You can find me on LinkedIn, Eugene Manley Jr. Our handles are STEM, STEMCHEQ on Facebook, Instagram, and LinkedIn for the org. And also on Blue Sky, you can find me and SCHEQ. And it'll be just SCHEQ on Blue Sky. And as an aside, we also are just launching an LLC that I'm waiting for the paperwork to come in. So I'll be doing more public speaking, more grant writing, and the training stuff. So if people want to interact or need services, happy to just reach out to me. You can just reach out to me about info@scheq.org, and then I will route stuff accordingly.
And hey, I'll get the rest of that information from you, and I'll put it out there for people on the episode for sure. Well, hey, if you're good, I'm gonna take us out, and we'll shut her down.
All right, awesome. Thank you so much.
God bless. Godspeed to you all for this week, and never forget, grit, don't quit. We are out.